University of California, San Francisco has been part of ABMS's portfolio program since 2013. Several years into our program, we sought to determine its value to our physicians. We surveyed our faculty who had claimed credit to determine whether it saved them time and increased their engagement in quality improvement activities. We found that physicians were enthusiastic about the amount of time that it saved them, and they were enthusiastic about the increase in engagement in the institutional quality improvement activities. The portfolio program has been extremely successful at UCSF. I would encourage any organization to consider becoming a portfolio sponsor because it supports a culture of quality improvement throughout the institution and among the physicians.